So ARNI, or a combination of sacubitril and valsartan, is a key component in the treatment of heart failure. It's one of the four foundational therapies for heart failure, which includes ARNI. If ARNI it's not possible to give, then only we give ACE inhibitors or ARBs. The other one is beta blockers. The third one is SGLT2 inhibitors, and the fourth are mineralocorticoids. And for symptom control, of course, you can use diuretics. So the out of the four foundational therapies, probably the most important one is ARNI. This is a therapy that adds on to people who are already on ACE inhibitors or ARBs. So this is the wonderful thing about ARNI, is that although it seems to work similar to ACE inhibitors or ARBs, it gives an incremental benefit in mortality, symptom reduction, decrease in sudden cardiac death, as well as decrease in objective parameters of heart failure like BNP and repeated hospitalizations also. So there was a very important trial for this called the Paradigm Heart Failure Trial. So this showed all the benefits that I just talked about. And then there was a trial called Pioneer, which used this drug in patients who were admitted with acute decompensated heart failure. You know, patients with heart failure can be admitted for the first time because of heart failure, or they could be known patients of heart failure who frequently come with decompensation, or you could see them in the outpatient department also with milder symptoms. So this was a trial for patients with acute decompensated heart failure, and here initiation of ARNI in the hospital itself gave very good results, and the results were evident at 2 weeks and very clear at 8 weeks. So because almost 50% of patients who are hospitalized with decompensation get readmitted within a month, it's very important to do whatever is necessary for them at discharge or before discharge. This usually includes uptitration of diuretics if possible, and more important, to start these drugs and uptitrate them every 2 weeks. So this is also something very important. So when patients come with acute decompensation, most of them might be on beta blockers, and you might actually stop them. So we need to reinitiate the beta blockers once the extra fluid has been removed. And then of course you can start them on SGLT2 inhibitors. And now with this new trial, we know that you can start them on ARNI as well. The only thing with ARNI in these patients is that if the blood pressure should not be less than 100 millimeters mercury. So in your patients, in outpatients, or in patients who are not in acute decompensated heart failure, your cutoff point most probably is around 90 millimeters mercury. And very peculiarly in many of these patients, actually the blood pressure does not decrease, and in some people we have actually seen the blood pressure seems to improve, most probably because the ejection fraction and other parameters of heart failure are actually getting better.